Hi, my name is Sue McCarthy Robinson, and I'll be discussing the trend group of telehealth because it is, one of the most significant healthcare trends um, that we're seeing. Telehealth functions as a key element of technological transformation in our healthcare systems, which has transformed healthcare delivery methods and patient access to care and their overall experience at all geographic levels. So the impact, of telehealth on decision making, affects local healthcare decisions regarding resource distribution and staff management and patient assessment procedures. Telehealth platforms enable healthcare providers in rural and underserved areas to provide specialty care services while, shortening wait times, minimizing emergency room visits. The transition requires healthcare organizations to, spend money and broadband infrastructure on that, in the development of it and employee training for successful, virtual care implementation. Since the pandemic, the COVID-19 pandemic, this triggered a rapid increase in telehealth adoption through the US. The pandemic response included both, a relaxed telehealth rule and expanded payment coverage for Medicare and Medicaid services. Healthcare organizations are currently, redesigning their care delivery models to combine traditional and virtual healthcare services. The federal government's decisions about provider licensure and cross-state practice and reimbursement rates require strong policy advocacy. Telehealth, enables worldwide health partnerships through its ability to support remote medical diagnosis and infection disease monitoring and mental health service delivery. The decision-making process at this level requires evaluation of digital equity alongside, that cybersecurity measures and the cultural, acceptance of virtual care among different, population groups. So that impact on that patient care access, telehealth dramatically expanded patient access by eliminating barriers like transportation, long wait lists, availability, and geographic isolation. Remote visits offer consistent and timely care to patients who have mobility issues or chronic conditions or behavioral health needs. My arena that I work in now is with a behavioral health population, and sometimes it is more appropriate to have a telemedicine visit versus transporting someone who might be verbally or physically aggressive to an office. So, however, the digital disparities persist. Patients who are low income, elderly, or in a rural area may not have the devices, internet access, or digital literacy to actually utilize telemedicine, which inadvertently widens health inequities. These access barriers need to be addressed to ensure that telehealth benefits are equally distributed. So influence of that on the culture and diversity. So, sometimes there's a trust in utilization of telehealth services. There's a barrier there, depend on the culture and diverse factors. Traditional healing beliefs together with communication nuances and distrust in technology platforms need to integrate language barriers and accessibility for persons with disabilities and cultural competent care practices. Healthcare providers, need to identify and solve implicit biases while providing, we need to provide interpreter services and representative provider choices and culturally, respectful communication tools. Telehealth has the potential to exclude marginalized populations from its services when it lacks proper consideration. So the role of the DMP prepared nurse. The DMP prepared nurse serves, as essential professionals for advancing telehealth practices in modern complex health settings. Through their evidence-based practice combined with advanced leadership abilities, they can develop telehealth programs which meet safety standards while maintaining a quality and effectiveness. Their scientific expertise can enable them to lead implementation by assessing virtual platform outcomes for chronic disease management. Nurses use informatics and technology literacy skills to examine digital health data, which helps them enhance platform usability and operational efficiency. Nurses act as ethical guardians who maintain telehealth policies, which safeguard patients' privacy while ensuring equal healthcare access. There was a systematic review in a medical journal from 2021 that demonstrated that nurse-led telehealth models decreased hospital readmissions while improving chronic disease management and patient satisfaction. The DMP nurses work to create policy changes through their efforts, which include fighting for equal broadband access, that we mentioned earlier, and developing institutional guidelines to integrate telehealth into routine medical practice. Telehealth represents more than just technological advancement, in closing, because it transforms how healthcare services are delivered. The system affects choices at a multiple organizational level while transforming access to healthcare and the demanding culture humility from healthcare providers. Thank you for your time today.